Good evening, and welcome to our first virtual meetup, COVID-19, Mind Over Matter. I'm Nicole Schaefer, Director of Professional Medical Programs for Cure HHT. Just a few reminders, tonight's conversation is being recorded and will be posted on our resource library on www.curehht.org. After the webinar, you will receive an email with a short survey. Please take a few minutes to give us your feedback. Your input is critical to the development of future presentations. To help reduce background noise, everyone's phones or microphones have been muted, but you can ask questions throughout the presentation by simply typing your question into the gray panel on your screen. I'll ask as many questions as time allows. You'll also notice in the gray panel that we've included 3 handouts that can be downloaded at any time during tonight's presentation. Just simply click on the handout on the gray panel on your screen. And also, we ask that you remember that to ask questions tonight that are related to the topic so that the answers will benefit everyone. Before we begin, I'd like to introduce tonight's panelists. Dr. Sara Palmer is Cure HHT Board President, a retired psychologist from Johns Hopkins University School of Medicine, and an HHT patient herself. Over the course of her career, Sara has been a clinician, researcher, and consumer educator, specializing in emotional and social aspects of illness, disability, and family caregiving. Dr. Palmer is currently active as an author, speaker, facilitator, and volunteer, and she is the author of the only comprehensive book about HHT entitled Living with HHT, Understanding and Managing Your Hereditary Hemorrhagic Telangiectasia. Phyllis Loveland has been Cure HHT's Operations and Communications Manager for the past 2 years. Prior to working for the Foundation, Phyllis earned a BA in Business and Communications with a minor in Writing. Phyllis's 20-year career span began as a legal administrator and paralegal for one of the leading medical malpractice defense law firms in Baltimore. After working with some of the top healthcare providers across the country during her legal tenure, Phyllis elected to use her medical, legal, and managerial skills to transition to the nonprofit sector. I now ask Dr. Palmer to turn on her webcam, and I hand the program over to you.
Hello, everyone, and thank you for coming tonight. I welcome you, and I hope everyone is staying well and managing this difficult time. That's what we're going to be talking about today. I just had a disclaimer I wanted to talk about, which is just to say that this webinar is providing general information on coping strategies for managing anxiety, and it's not intended to be a substitute for any kind of treatment. It's not intended to be a treatment. So if you have any individual problems with anxiety or other mental health issues that you need assistance with, please contact your own primary care physician or a mental health professional.
So what is anxiety?
Oops, sorry. So usual anxiety, which is something that we all experience, is distress or uneasiness that's focused on a specific threat of danger or illness or misfortune. And usually with anxiety that's not overwhelming, it can spark productive planning and solutions to cope with that anxiety. It also lessens when you use coping and problem-solving skills. More excessive anxiety can happen when you feel distress or uneasiness that's generalized, so it's not related to a specific threat, but more a situation where everything feels threatening. Sometimes the anxiety is out of proportion to the actual level of danger, and it can feel overwhelming or interfere with your usual activities. But when there's a persistent external threat, like we have now with COVID-19, the lines between usual anxiety and excessive anxiety can tend to blur. The symptoms of anxiety have to do with feeling worried, stressed, and uneasy, feeling out of control. Sometimes people, when they're anxious, will eat too much or lose their appetite altogether. Sometimes they'll feel fatigued or exhausted. They may have difficulty concentrating or completing tasks. And I think that's very much what most of us are feeling, some of that right now, because it's a time when we all feel kind of discombobulated and our routines are really out of whack. Sometimes people have more severe anxiety symptoms, and these can include feeling of panic, having physical symptoms like chest pains or headaches, or a rapid pulse or heartbeat. It's important to remember, though, that anxiety is something that is a normal response to danger or threat, and it happens to everybody. It's usually temporary and manageable. But if you find that your anxiety is so severe, persistent, or overwhelming that you really can't do your usual tasks at home or work, then you might want to seek professional help.
What are some tools we can use to help reduce stress and anxiety?
So the first thing in terms of dealing with anxiety related to our current pandemic of COVID-19 is to make sure that the sources of information that you use are reliable. And that would be things like the CDC website. And Phyllis will later go over some of those resources where you know that you're getting reliable, up-to-date scientific information, and it's not just rumors or things that people are kind of making up. Because the more you have reliable information, the more you can actually cope with the problem. Another technique is to write down some of the things that you're worried about, because individuals worry about different things, and sometimes just putting it down on paper can help you feel more a sense of control or mastery over your anxiety. Once you've written things down, then you want to stay focused on the current specific problems that you've identified, and try not to let yourself get caught up in other problems that don't have to do with what you need to solve immediately. When you make a plan to solve the problems that are affecting you and your family, you can do it by breaking down those problems into manageable tasks and taking a step-by-step approach so you don't feel you have to do all of it at once. Another thing that really is helpful is to talk to other people, your trusted friends or family members, talk out your problems and work on solutions together. And sometimes even just for practical things like, where can you get grocery delivery? Or, where can you get information on something that's a good thing to do? But if it's something more complicated, that's especially helpful to get input from other people. And the final thing right now is that I think we all need to accept that we can't know or control everything that's going on in this situation. And in some sense, we have to trust that the people that are experts are trying to figure it out, and that we'll just stay informed and do what we can do. So one of the things that's important about managing anxiety while stuck at home is to take care of yourself. And set aside some time each day if you need to do a little worrying, because we all are worried. Maybe it's in the morning when you first get up and look at the news, or maybe it's later in the day, but try to keep it contained so you can go about your business the rest of the day and not be worried all day. It's important, similarly, to stay informed and to be watching the news and know what's going on, but you don't want to watch the news 24/7 or scroll social media for hours and hours, because that will just make you more anxious. Some people really find that practicing relaxation techniques like yoga or meditation can be very helpful, or breathing techniques, for example, at this point. And there are some good information on how to do yoga, or how to do meditation, or how to do breathing exercises that you can find online and even on YouTube. So those are things you can explore. Another thing is to make time to do some pleasurable activities every day, and not to feel that because there's a crisis, you're not allowed to enjoy yourself. It's really good for reducing anxiety and also for dealing with the claustrophobia of being home all the time, to try to get outside if it's possible for you to do that without violating the social distance rules of being too close to other people. So, if you can get out and take a walk, take a jog, ride a bike, or sit in the park, those are some great things to do. And then there's something called positive affirmations, which is basically saying things to yourself about how you're able to cope. messages that you can give yourself, like I can do this, or I'm strong, or I'm confident, or I've done this before, or this will get better. In terms of other things to take care of yourself, it's really a good idea to make a routine for your day, even if you're not going to work. That will help you keep your mood in good shape, as well as your physical health. So make sure you get adequate sleep every night. And it's especially important with using computers and social media and all the online stuff, that you try to put that aside a little bit, maybe like an hour before bed, turn everything off so that you can relax and get to sleep. It's a good idea to get dressed every day. One of my neighbors was joking about wearing his daytime pajamas and his nighttime pajamas, but it's better if you can actually put clothes on, even if you don't have to go out. It's good to keep eating at regular times. And then you might want to do something to make your weekends a little different from your weekdays, like doing something special, a special breakfast or a special activity with the family. Exercising will keep your mood better. It's good for both anxiety and depression. If you can't get outside, then there's plenty of things you can do to exercise inside. Another idea is to schedule a mixture of alone time, where you have some time alone in the house, and together time with your family or housemates. So even if you're, all living in a small apartment, maybe you can find one room that you can go into for a while and trade off having some time alone and separate, so that you don't feel overwhelmed by being in the same closed-in space all the time. Another thing that's a good coping strategy, since we all have more time too, is to set a goal or an intention to learn something new or to complete a project that's been hanging around for a while that you might not have had time to get done, so that you can feel there's something positive coming out of being at home. And then the final thing is to think about helping somebody else if you can, because when you help someone else, it usually helps you master your own anxiety or fear. So if you check in on your neighbors and friends by phone and see how they're doing, you check up on especially some of the elderly people that you know, and maybe if you can, if you're young and you're able to do it, to do some errands for others might actually help you feel better.
How can we avoid feeling lonely while practicing social distancing?
So some strategies to avoid feeling loneliness include just keeping in touch with people, your friends and your family by phone, and using FaceTime and video chats. It's good to use social media to keep in touch and know what's going on with people, but I would say that in terms of managing loneliness, it's better not to do it too much, because too much scrolling on FaceTime can make you feel more isolated. Whereas if you actually, if you actually call people on the phone or chat with them and video chat, or even if you email them and have more of a pen pal relationship, you'll probably feel more connected and supported in the long run. When you're outside for walks, if you are outside, try to wave and say hello to people, make eye contact. Everybody seems to be, at least where I've been walking, people seem to be hungry for contact and appreciate it when you say hello to them. Another thing is to write a diary or journal during this time, which can help you get your feelings out on paper and actually decrease your loneliness. It's almost like talking to yourself. You can even set it up to do it as if you're writing a letter to somebody else, telling them about what's going on. Making some time at home that's special with your family or your housemates, I think is a good idea, so that every day doesn't seem sort of endlessly the same. And some ideas for that might be to have a special game night, or even though you're eating at home every night, to have a fancy dinner using the fancy dishes once in a while, set up a home date night, or anything else special that you can think of, maybe once a week. And then since you have people in your household that you aren't keeping social distancing from, like maybe your spouse and your kids or your roommate, try to hug them, try to have some physical contact if you can. And of course, if you have pets, they're a great source of comfort for anxiety, so cuddle your pets.
How do we help our children understand what's going on?
One of the most important things with kids who may be anxious right now too is to ask them specifically what is worrying them, because their worries could vary from very mundane things to really scary stuff. And you want to know what it is that's on their mind so that you can answer their questions and concerns without overwhelming them by talking to them about things that they might not have even crossed their mind yet. So you want to let them give you the lead. You can tell them about how you're managing the issues that are concerning them, what you're doing to stay safe and stay healthy. And that usually reassures kids. It's very important for kids also to have a routine, and especially now when they're home from school in a lot of places, to make sure to include some school or educational time, reading time, and then some time where they can just have unstructured playtime. And also to make sure, if possible, that you get them outside, because that will really help them concentrate when they're back inside, and help them get their physical energy out, which decreases tension and anxiety. Structuring active times when they're home, if you can't get out, is a good idea, like maybe having a dance time and putting on some music, letting them dance and spin around, or anything else that you can think of within your home that's an acceptable physical activity for them to do. And then finally, teaching them what to do about the epidemic itself and how they can be part of helping to reduce people getting sick by washing their hands and keeping social distance and so forth.
How do I take care of my HHT while practicing social distancing?
So I'm sure a lot of you have concerns about how to take care of your HHT, especially with regard to whether you should go to the doctor or go to the hospital, what you should do during this time when a lot of hospitals and doctors are not having anybody come in unless it's essential, and you may not know whether what you need is essential or not. So what I would suggest is that you call your doctor to decide whether or not you should come in, whether you should postpone a non-essential doctor's visit, whether you should continue with things like your planned infusion therapies for iron or Avastin, and whether you should continue with procedures that have been planned, such as embolizations or laser therapies. Some of those may be canceled and it may be beyond your control, but if there's any question and you want to really look at the risk-benefit ratio of getting a certain treatment versus staying away from the hospital at this time, then you should definitely call your doctor and find out what they think is the best thing to do. The other thing I would suggest is that if you're somebody who has bad nosebleeds, that you try to have a communication with your doctor about what parameters you should use to decide when you can treat a nosebleed at home and when you need to go to the hospital. Probably on balance, if you can, it's better to stay out of an emergency room right now, but there may be some times when that's really not possible. And finally, if you have nosebleeds and you have a nosebleed kit, in other words, certain items that you use to stop a nosebleed, and you need those supplies, I would suggest trying to get things when you're already going to the grocery store anyway, or there may be things that you can order online, but I would try to keep that well stocked. There's a couple of silver linings in terms of benefits to having more time at home during this time. And one of them is that, as we said before, you could try to learn a new skill or hobby. You could use time to catch up on relationships with family and friends that you don't normally have the time to call and chat with. And you could complete some home projects and some honey-do lists that have been hanging around and haven't gotten done. And another thing is that you can enjoy more leisure activities that you may not normally be able to have the time for. Since we're talking about HHT, you can also use that time to read and learn more about HHT. And there's a number of things that you might want to delve into. If you're newly diagnosed, you might want to look at HHT symptoms, diagnosis, and management. You might be more interested in finding out about the newest treatments for HHT. You might want to look at research studies. You might have questions about how you can talk to your family about HHT or what to do to keep your kids healthy. Now, whoops, sorry. Now, Phyllis was telling you, Nicole was telling you about my book, which is called Living with HHT, and that's a place where you can learn all of those things, as well as getting more information from the Cure HHT website, which Phyllis will tell you about in a minute. This is a picture of me signing my books after they first came out. So what's in the book, Living with HHT? Well, as I said, pretty much all the things I just mentioned: diagnosis, symptoms, complications. There's details of nosebleeds and how to manage them. I talk about all the screening tests and treatments for AVMs of various kinds, and preventive measures you can take and how to avoid complications. And then, since we're talking about anxiety today, there's a whole section in the book called Living with HHT, which really delves into the emotional and social aspects of HHT. So I talk a lot about self-care and how to improve your emotional health with this disease. Family, work, and social issues and advocacy are also included in that section. And then there's a section on research, which looks at current research studies and how and why it's a good idea to participate as a subject in some of these clinical studies if you can. As I tell everybody in the book and when I'm talking about it, there's many more things that have happened with research even since I wrote the book a couple of years ago. So you have to keep current also by reading the book, but also by looking at the Cure HHT website. There's also a glossary of all the medicalese terms that you might run across when reading about HHT, and there's a whole list of resources, including most of the current HHT centers of excellence in North America.
Great, thank you so much, Sara. So now we're going to transition to Phyllis. I'm asking Phyllis Loveland to put on her webcam, and Sara will be back for Q&A at the end of Phyllis's presentation. So now we're going to talk about, oh, sorry, Phyllis. We're going to talk about how do I stay informed about HHT and COVID-19. Next slide.
Good evening, everybody. I appreciate the time you're putting in tonight to spend with us, and we really appreciate Dr. Palmer's synopsis about anxiety and dealing with the social distancing and being at home. I know I've enjoyed actually being home a little bit more, catching up on some reading and being able to spend some quality time with my loved ones. But what I'm here to talk about tonight is the information that you're seeing, a lot of the information that you're seeing coming out from multiple sources, and trying to hone in on what is good information and what you just need to avoid. So you probably have seen the hashtag Stop the Spread, and it has two meanings. When COVID-19 was moved to a pandemic, this hashtag was created, and people are using it on their social media channels, but it also has a second meaning. Yes, stop the spread of COVID, but it also has stop the spread of misinformation. And with that pandemic, unfortunately, we have also had an infodemic come with that. And what I mean by an infodemic is we are being plagued with lots and lots of information, and it's great to have that information at our fingertips, but we really need to be able to differentiate between what is good information and what is bad information. So the first thing I recommend is always check your sources. Before you text your friend or text family members, make sure that you're getting the information that you're sharing from a reliable source. It's really important. And that's one thing that we can do to help, quote, stop the spread, by stopping misinformation to get it from getting out. So be careful what you're putting out on your social media channels before you check. And there's a couple internet sources that we have available to us. They're very reliable, Snoops and Fact Check. They're very accessible on the internet. They've done a great job of already, you can see the categories that I've listed. There's a compilation of claims that have already been fact-checked surrounding COVID-19, from the origins and spread, all the way down to how it's affected business industry, entertainment, and even for you conspiracy theorists who likes all of that intrigue and predictions, you can even read which ones have merit and which ones don't. Can we have the next slide? One of the organizations that we like to gather our information from our website and pass down to our patients is from the World Health Organization. Because we are a global organization and we are the voice of the HHT community around the world, we like to rely on what the WHO has to say. Their information can be found at their website, www.who.int. And I pulled out one of their Mythbusters, and they have about 15 of these. So they're little infographics that have the 15 most common myths about COVID-19. And I picked this one, drinking water. Does this protect against COVID-19? And they give you a little quick blurb about, yes, it's great. It's obviously water is always good for your health, but it's not going to wipe out COVID-19. There was a rumor going around a few weeks ago that if you drank, 15 bottles of water a day, it would wash COVID out of your system. So anyway, this is just one example of the Mythbusters. So you can check those out on their website. Next slide. I've listed some reliable resources, and I started with our international ones. Again, the World Health Organization has the most up-to-date information for all of our patients around the world, including those here in North America, but again, globally. And then here in the United States, we rely a lot on the Centers for Disease Control with the CDC. You've probably heard it called that, but that's what the acronym is. And they also have lots and lots of great information from topics like Dr. Palmer covered tonight, down to where they are with coming up with a vaccine, how that progress is going, and disseminating all that information you're hearing from all of these different spokespeople that you see on TV and on social media. So it's a great resource and very reliable information. From there, you can look at your local sites. And I picked New York and California since they've been hit the hardest. But every single state here in the United States has a website for the state, and they all are the same. It's www. And then the abbreviation for that state.gov. And every one of them has their information and what protocols are in place for your state. So what may be happening in California may not be what's happening here in Maryland or in Massachusetts. So you want to be sure that, when you're seeing things on social media, you may be viewing things from people all across the country, all around the world. So again, what you're seeing someone say, oh, well, this is what's happening at my child's school and they're closing schools, may not be the same as someone that's in Arkansas or someone that's in Illinois. So definitely want to check your local sites. One of our centers of excellence, Johns Hopkins Hospital, which is right here in Baltimore, and it's a level 1 hospital treating COVID-19 patients. They have an excellent resource center on their website. You don't have to be a patient there. You can log on and see all the information. They are the hub of a lot of the information from the medical community if you want to get that information straight from them. And that's at their Coronavirus Resource Center, and you can see the website there. I highly recommend it. Have a lot of valuable resources, and they're also tracking the numbers across the globe. I think the CDC has them doing that, and they're tracking the numbers and keeping that map up to date for people that are interested in that. Also, all of our North American HHT centers and our international HHT centers have their own websites, and most of them are also providing information on their sites about COVID-19. So you can certainly check those. And they're following, each of our centers are associated with a institution. So many of them are following the protocols of their own institutions and getting that information on their website. Of course, our Cure HHT website has tons of information. We have a special page dedicated just to COVID updates. We do new updates every Thursdays. We get our information, again, from CDC, and for our patients, from all of our directors in their different specialties at our centers of excellence. You've probably seen some of those already from our interventional radiologist regarding lung AVMs, our hematologist regarding your anemia and iron infusions, and things like that. So definitely check our website. Again, if you want to cut down on the amount of time that you spend on the internet and looking at all of this stuff, just pop back on Thursdays, and that's when you're going to get the latest update from us. Next slide. This is today's message, and we featured some information. What we've done is we've contacted all of our center directors at our 28 centers of excellence across North America and asked them what protocols are in place for visiting and coming in to see doctors, whether it's for a procedure, whether it's for a checkup, whether it's for your genetic testing. Many of them have virtual visits set up, and we are going to be featuring tomorrow. We'll have a whole chart of each of our centers and what their protocols are, so you can pop on and see, yes, they're seeing patients virtually and what platforms they're using, what procedures they're still doing, which ones they're putting off for several months, and so forth. So we'll have a comprehensive list there tomorrow for you to see. And then we also today posted a warning from the FDA that we received. There's a lot of myths out there and people that are soliciting, cures for COVID-19 and try this treatment or drink this or whatever it may be. And basically the FDA is saying there is no known or approved treatments for COVID-19 that they have approved. So anyway, they just want people to know that a lot of these gimmicks that are out there, please avoid those. They could interact with treatment that you're receiving for other conditions. Next slide. So when you pop onto our website, you'll see our COVID-19 updates. As I said, we'll update that every Thursday. And then we have lots of other resources. Nicole and I are very excited. In 2 weeks, we're going to be hosting a webinar and introducing you to our all-new revamped resource library. We're really excited about it. Lots of information for not only patients, but providers, medical articles, blog posts, videos, lots and lots of information that you can share with your medical providers to continue that education piece and with your family members. So we're going to be rolling that out next week. And then, as I said, Nicole and I will be hosting a webinar to walk you through it and show you all the great new information that's in there. Again, we have a list of our centers of excellence on the website, newest treatments, on how to manage and the symptoms of HHT, the research studies that have already been done, what to do to keep your children healthy, our list of former webinars. Now that you're spending a little bit more time and maybe at home and you didn't have a chance to watch some of our webinars, we have some pre-recorded ones from the past that we'll be introducing and bringing back. I mean, they're all on our website, but we're hoping to push some of those out again to give you some more content. And then frequently asked questions. That's also available on our website. Next slide. And I'm going to end with, these are our list of our resources. Catch us on all of the social media platforms. We're on Facebook. We have 2 Facebook groups if you'd like to interact with other HHT patients, particularly now, as Dr. Palmer said, when you're feeling isolated. If you have a question or you just want to connect and say, hey, how you doing? How do you manage this? We do have 2 Facebook groups where you can do that. And so pop on there and check those out. Instagram, we try to make that a little more photo-centric and a little more fun just to make it a little bit light. We were putting a lot of our event information on there, which, as you know, we've had to postpone because of COVID-19. And then Twitter, for those of you who like to tweet. And then LinkedIn for more of our medical articles and information coming down from our medical community. We post there. Our resource library, we have a blog. If any of you would like to send us your story or would like to be a guest blogger, we're always looking for new content to put there. And then, of course, Dr. Palmer's invaluable book, Living with HHT, which you can purchase on Amazon through your Amazon Smile, or you can purchase through us here at the foundation. And that's all I've got tonight. I'm going to turn it over to Nicole. Thank you.
Thank you, Phyllis. So if Sara and I are both going to put our webcams back on, and if Sara, if you could please advance the slides to the final slide. And while we're doing that, I just want to thank Dr. Palmer and Phyllis for their insight, guidance, and resources during this unique time in our history, and that we just really do truly appreciate all that they do for QHHT and the community around the world. So we do have several questions. So we'll start with, the first one is, should I let my children have play dates?
I guess I'll take that on. I actually looked on the CDC website today to see what they were saying about that, because they're probably the best resource for that question. And it looks like they're saying that, you know, if you're going to have a play date, make sure it's just with a couple of kids and try to keep social distancing as much as possible. And they were also suggesting that if you have a play date, that it should be with maybe one other family where both families have already confirmed that they are each practicing social distancing and not having interactions with other families. In other words, keep the circle as small as you can. And probably the safest thing is not to have it. But if you're, you know, it's very hard with kids not to see any other kids. Doing a play date outside and being able to, you know, separate kids more spatially and have them do sort of parallel play and run around together might be the safest way to do it.
Great, thank you. So we have another question about, do we have to clean bags, cans, and boxes from the grocery store?
You know, I think that it's probably not necessary to clean and wipe every single box and can that you get at the grocery store. I think if you're worried about it and it's going to make you feel better, then putting, you know, as you put things away, to wipe them with a sanitizing wipe, it certainly couldn't hurt anything. But I think the virus, you know, from what I understand, does not live that long on those kinds of surfaces. So the main thing would be really when you get stuff from the grocery store, after you put everything away, wash your hands. Wash your hands when you first get in the house, after you've been at the store, wash them again after you've put everything away, and then wash your hands before and after you've handled food or made dinner. That's probably pretty safe. And, you know, you could check out the CDC website or other reliable sites if you want to really check that out more.
Great, thank you.
Okay.
I think the biggest part of that is just washing the fresh produce. That's, you know, most of the information that's come across my desk is about washing things that are open and not purchasing bulk food at this time and things like that.
Yeah, I think that's a good idea. It's always a good idea to wash your fresh produce because you never know what's on there in terms of pesticides and so forth anyway. So yeah, just wash it as thoroughly as you can. You can just use water. You can use, there's some organic soaps that you can get that you can actually use a special kind of soap to wash your vegetables if you really want to be careful about it.
Great, thank you. So our next question from our audience is, for those of us who work in the medical field, should we take extra precautions or avoid working with positive COVID patients if possible?
Do you want to answer that, Phyllis? Do you feel like you have some insight in that?
I mean, obviously, you're going to take the same precautions that you always take. You know, I'm sure each of the institutions and where you're working have those same protocols in place. I know a lot of people that I've come in contact with that are in the medical profession, when they go home, they have separate clothing that they change out of. They have separate shoes. Basically, they completely change before they come home so they're not transmitting anything at home. And again, just, you know, repetitively sanitizing things when you are home. Keeping the counters clean, doorknobs, places like that, you know, you touch. But that's pretty much the information that I've been seeing that's been coming across from the CDC.
Great. Okay. Thank you. Someone is asking, which I think, Sara, you touched on a little bit, even with the children and play dates. But a lot of people are talking about wanting to visit immediate family if they haven't had any exposure. How do you gauge the exposure people may or may not have had before making the decisions to take those visits?
Well, I think it's a little tricky because, you know, again, if you know that your immediate family members or the people you're going to visit have not had contact with anybody else within, say, you know, some reasonable period, and you haven't either, then theoretically it might be okay. But it's very hard, you know. Well, most of us are having some kind of exposure, even if you're just going to the grocery store, or you're just going out to pick up medicines or essential things. And of course, you know, we didn't know that this was even happening until recently, so we don't really know how much people have exposed. So it's kind of an iffy situation. And certainly if they're not in the immediate vicinity, you might not want to go because you don't want to travel right now. You can help it. I mean, I think the guidelines of avoiding, you know, non-essential travel should probably be followed. And the other thing is, you know, if you're visiting a relative that's elderly or that's got any kind of other medical conditions that could make them vulnerable, it's really probably best to stay away unless you have to go and help them. If you have to go and help them with something where it's necessary for you to be there, then you want to try to keep your distance as much as possible.
Okay. You talked about relaxation techniques, and a lot of people are talking about breathing exercises or meditation to calm their anxiety. And we have someone asking, where can they find these resources?
Yeah, so for both breathing exercises and for meditation, there are some really good apps that you can get through your phone or smartphone. And there are also some YouTube videos that anybody can access that are guided meditations or guided breathing exercises. I made some notes on these before. Let me see. You can also find some of these things through some of the medical websites like WebMD. I think there's, I'm trying to remember the name of the other one, but you can Google it, you can search it online, and you'll find that there are websites that will also give you instructions on how to do deep breathing, how to do relaxation breathing, and how to do meditation. But I think apps, for example, there's one called Headspace, there's one called Calm, there's one called Insight Timer. There's a whole bunch of them that you can find that will teach you how to do it.
Okay. Now, we've had several people, as we would suspect, ask kind of medical related questions, which we're not really here to talk about today specifically, but if either of you would feel comfortable just giving people direction on, particularly if they've had lung surgeries, if they're anemic, is this putting them at higher risk? Are there certain recommendations specific to HHT patients? And I know, Phyllis, you've been working directly with some of the centers and some of our specialists in this area, so maybe you could talk to that.
Mm-hmm. Sure. So what I would say is that, and the information that I've received from our center directors have said that while people have those issues, those health issues, that doesn't make them more susceptible to COVID-19. But if they contract COVID-19, it can cause more complications. So if you look at our website on our COVID-19 updates, 3 of our leading interventional radiologists discuss and talk about lung AVMs and the relationship with COVID-19, and have suggestions on there and information that you would want to give to your provider should you unfortunately come down with COVID-19. So you could copy that information and provide that to your doctor if that did happen in your case. And then again, checking with your own doctor if you feel that you have these symptoms, but just letting them know what your underlying HHT complications are, because as we all know, HHT patients have varying symptoms. But that would be my suggestion, and that's what's coming down from our center doctors.
Yeah, I would agree with that. I don't really have anything else to add other than, what I said before of just if you have particular concerns about any kind of procedure or any kind of new symptom to get in touch with your own doctor.
Okay. Going back to reducing anxiety, do you know of any particular foods or beverages that help people with reducing anxiety?
I don't know of any particular foods. I haven't heard about any particular foods that do that. I would say that, though, in general, if you are feeling anxious, that one of the good things to do is to eat something that you consider comfort food, whatever that might be, that makes you feel good, and to eat mindfully so that you sit down, you don't have the TV on, you don't have distractions, you think about what you're eating, you chew slowly, you savor your food, and it becomes more of a relaxing experience as you focus on what you're doing with eating rather than being distracted with a million other things. So that's really all I would recommend there. And as far as beverages, a lot of people find that chamomile tea is relaxing, or any kind of herbal tea, or really any hot beverage that does not have caffeine in it. Can be relaxing. And again, I think how you drink it is maybe more important. So, you want to put your hands on the cup and warm your hands and really sip it slowly and enjoy it, and take it as a time for yourself where you're focusing on what you're doing and enjoying it and relaxing, so you're not, trying to guzzle it while you're doing something else.
Do you have anything to add to that, Phyllis? Or?
No, I think Dr. Palmer covered that really well.
Okay. So we have a couple of people who are talking about either their job puts them in a situation where maybe they're restocking shelves, they're around people and products a lot, or we even have one person who's written in and their husband actually has the virus, and her son has HHT, and they're trying not to track the virus, and so they wear a mask and gloves when they're in the quarantine room, and they're just asking if there's any other recommendations. I mean, I would think that if you had a direct family member you're caring for that has coronavirus, or if you're working in an environment where you feel like you're at risk, you probably need to be talking with your medical professionals for guidance on how best to protect yourself in those situations. Do you have any other recommendations?
No, I think that's right. You would need to get advice from your medical providers. I know there's in some cases when people have the virus, if they don't need the family member to provide care for them other than, say, bringing them a meal, sometimes people are actually quarantining in a separate room in their house. But I would seek some outside guidance before you decide whether to do that or not. It's difficult to do.
Phyllis, any insight there?
No, I was going to say that's tough. That's really tough because you're trying to balance, having to go to work and taking care of your family. And there are situations where people are self-quarantining. There was an interview recently from the first female patient that was diagnosed with COVID-19 in Florida, and she did an interview earlier this week, and she talked about living with her younger sister. It's just she and her sister living together, and how her sister is also a nurse, but was quarantining herself while she had the virus in a room, and her sister was bringing her meals and leaving them outside of a room. They were using separate bathrooms just as much as they could to avoid, because her sister was then going to work. So it's really tough because not everybody has an opportunity or has a situation where they can go somewhere else outside the home. They may not have, and if they go to another family member's house, and they're, running the risk of infecting them too. So a lot of that self-quarantining is what's being recommended. But again, as Dr. Palmer said, and you said, Nicole, the best thing to do is to check with your internal medicine doctor and let them guide you what's the best practice for your family.
Yeah, and I
Right.
think
Okay.
in some areas, people, who have a direct family member who has the virus, I think even if they don't have it themselves, I think sometimes they can get tested. It just depends where you are. But that might be something to think about as well.
Okay. We have a question about maybe the best time to go to a grocery store or pharmacy. That just thinking about doing these activities is making people anxious. And so I'd be curious on your insight. I know locally here, several stores have senior vulnerable hours where they're opening up 1 or 2 days a week their store early just for people to come in who maybe feel like this. Are you familiar with any of the big chain stores that are doing this, or do you have any other recommendations?
Yeah, I think a lot of the stores are doing a senior hour, but I think also, if you're concerned about it, you can just try to go, if you're not a senior or you don't want to go during the senior hour, just try to go at a time when you suspect it's less crowded, like maybe later at night or very early in the morning. And I think the main thing is about the grocery shopping, because we all have to do it and it exposes everybody to some extent. I think the main thing to do to protect yourself is when you're in the store is to make sure you keep that social distance of at least 3 feet, better to have 6 feet if you can, while you're in the store, and to really, if you can, wipe the shopping cart handle. If you can't, definitely don't touch your face while you're in there if you can help it, because that's one place where you're touching things that a lot of other people have touched. If you just don't touch your face, and when you leave the store, you immediately sanitize your hands, and then when you get home, you immediately wash your hands, you're probably going to be pretty safe. There's some level of exposure that you can't help when you're in a public place, but you can try to reduce the risk that way.
Mm-hmm. And several of the grocery chains are instituting the social distancing rules. They're limiting the number of people in the store at a time, and they actually have people outside cleaning the carts before they let people inside the store. So a lot of the stores are taking those measures too to help, because they know that it's essential. People have to go to the grocery store.
Right.
So they're really taking those measures to try to help that. One thing I would say is we had, again, about the misinformation and, it actually rearing up additional problems. It was either last Friday or the Friday before, there was, a Snoop's rumor that was going around that said that, everything was going to be shut down by 5 o'clock that day. And it caused this panic of people running to the grocery store, which is exactly what we don't want to happen, because we want to keep the crowd numbers down. And there were hundreds and hundreds of people running out to the store. The grocery stores are going to stay open because that's an essential business. So running out in those crowds is defeating the purpose of the social distancing and keeping the numbers low. So try not to fall into that trap.
And I would also say that there are a lot of the grocery stores do have delivery services. I know there can be delays or lags in that, but if you really don't want to do that, I also know that, I personally have shopped for a couple of my elderly neighbors. If I know I'm going out, I'll ask them if they want anything, and I leave it at their door. My daughter has an infant, and they've had friends pick out groceries on their behalf and leave it at their door. So I think that it's an opportunity to reach out to your neighbors too, and just to let them know, I'm feeling anxious, or I have HHT and I'd rather not be around the crowd. If you go out sometime, could you pick me up some milk or some bread or whatever it is that you need? And so I think it's an opportunity for us to sort of, be part of the community too by helping people. But you kind of have to advocate for yourself in that situation, because not everybody's going to ask you. So you might need to ask others for the help.
Yeah, that's a good point.
And one last question, just talking about exercise and getting out and going to parks and things like that. I know here in Maryland, last weekend was very nice, and our governor came on Monday and said all the parks and everything were really busy and full with people, and he really wanted people to, get out but practice social distancing. How do you best suggest that we do get out and go to parks or into our front yards or walking a neighborhood and keeping that distance, especially as the weather does get better in some areas?
They're asking how do you keep that social distance?
Yeah.
I think, I think it depends where you are, but because in so many places that are heavily populated, people have been asked to stay at home, that actually the streets are pretty quiet. At least I know here in Baltimore they are. When I have gone out walking, it's pretty easy to keep social distance from people because there's just not that many people on the street. So I think in most places you can probably find a place that you can walk and do that. And I think if you go to the park, same idea, just try to get out and walk, but don't pass too close to people. If you see somebody coming in the opposite direction, try to move over and give them 6 feet of space. Don't sit and chat close together. It feels kind of awkward, but I think people are getting used to doing that and trying to be cooperative with each other in doing it. Unfortunately, there's been some cities where a number of the parks have been closed because people were not respecting the social distancing rules, and the city or state governments decided that they were going to shut down parks and beaches and things like that. So there may be less opportunity to go to some parks in some areas, but I think that I don't think there's any place at this point that I know of where you're not allowed to go out and take a walk. So as long as you can do it and just not be too close to other people, I think that's fine.
I was just going to say that, since the schools are closed, that's what I usually do in the morning, go up to the local schools because there's no one there and you can walk around the grounds. I don't recommend that the kids get on the playgrounds. Most of the schools have signs that say to stay off the playground. But you can take your kids up to the tennis courts, the basketball courts, they're all empty because school's not in session and you're not going to run into other people. So that's also a great place to go. People tend to gravitate to the parks first. So again, to avoid the social distancing, I would recommend that as an alternative.
Excellent, thank you. And the last question is, and I don't know if either of you know this, or Phyllis, having talked to our center directors, if this has come up, but are HHT patients considered an at-risk group? I know you said that they aren't more susceptible, but they could have more complications if they have lung AVMs or have had them embolized. But is that classified as an at-risk group? Do we know?
I have not seen that come across my desk, classifying them as an at-risk. Again, it would depend on age. If they're an HHT patient that's over a certain age, yes, then they would be in that high-risk category because of their age coupled with the HHT. But I have not seen anything that says that, anyone under the age of 60 with HHT is considered high risk unless they have comorbidities or other, diseases that impact respiratory issues.
Right, that's basically what I've seen too. So I mean, there are some patients who have, multiple lung AVMs, especially diffuse lung AVMs, where they might already be using oxygen therapy, or needing support to breathe. So obviously somebody like that would be an at-risk person in terms of having, more complications if they contracted the virus. But I think, they're not more at risk for getting it in the first place, probably.
Great. Well, again, on behalf of everyone at Cure HHT, I want to thank everyone for attending tonight's virtual meetup and for staying connected with us during this unique time in our world history. We are all in this together, and Cure HHT is the only patient advocacy organization in the world for HHT patients. And we just want you to know that we are here for you, for the entire HHT community of patients, families, healthcare providers, and researchers. And you can rely on us to answer your questions, provide timely updates, and offer support through COVID-19 and beyond. Cure HHT has one shared goal, and that's to give those affected by HHT a chance for a normal life. And our virtual meetups and webinar series are just one way that we accomplish our mission to do this. We are grateful to the donors of Cure HHT for making this and all educational activities possible. Please consider donating to Cure HHT to ensure we can continue to offer high quality education for you and your families. After the webinar, you will receive a short survey. Please take a few minutes to complete it so we can better serve you in the future. And again, I want to thank Dr. Sara Palmer and Phyllis Loveland for volunteering their time tonight to lead this virtual meetup, which has been recorded and will be posted on our website at www.curehht.org in our resource library. And just a reminder, there were downloadable handouts, which we will also make available in our resource library for the resource links that Phyllis provided, our social media links, and any other fact sheets that we have that Dr. Palmer has helped us put together on HHT and depression, how to talk to your physicians, how to talk to your teams, and those kinds of things. So we truly appreciate your participation tonight, and we hope that you enjoy the rest of your evening. Good night.
Good night. Thank you.
Yes, 1E. And 6 R. No, 2 R's.
C. I'd like to buy a vowel. A.
Yeah, 1A.